So I'm here to present the paper Trained Intensivist Coverage and Survival Outcomes in Critically Ill Patients, a nationwide cohort study in South Korea from the Annals of Intensive Care Medicine. This data was drawn from one of their data registries in which they looked at 1.5 million patient admissions to an ICU and then separated them out based on whether it was a closed ICU with full-time intensivist coverage versus an ICU that did not have full-time intensivist coverage. They did a whole bunch of subgroup analyses looking at people requiring ventilators, ECMO, and several others. When adjusting for many of the confounders, they found that the ICUs that were staffed by an intensivist had 22% lower in-hospital mortality and 15% lower one-year mortality. This suggests that having a trained intensivist is just as important as many other aspects of an ICU, such as ICU trained nurses and better patient ratios and so on and so forth. This may seem like kind of a no-brainer, and I imagine a lot of you probably have never worked at a place that has an ICU without an intensivist, but this is actually common in a lot of areas, especially in rural areas where they may not have an intensivist available. I can tell you, I used to work at places in Louisiana, PRN, in rural areas, and they did not have a full-time intensivist coverage, and some of them didn't even have an intensivist at all. While the study does not specifically address staffing issues, broader coverage with more training and getting more intensivists out to some of these rural areas may potentially fill some of these gaps. So if we had more intensivists available to cover or even tele-ICU. And additionally, I do have to state my bias here. I'm going back to training this summer to become an EM intensivist. So I'm a bit biased towards the benefits of additional training. However, again, the study does highlight the fact that having that additional training and having them available for coverage does improve patient outcomes.